The Hondius outbreak just got its first peer-reviewed clinical record. NEJM published the case sequence today. Patient 3 was evacuated from Ascension Island on April 27th, and Argentine scientists are out trapping rodents in Ushuaia right now. This is Hantavirus Watch, and for the first time this week, the primary sourcing is peer-reviewed, not just press releases. 2 NEJM papers landed today, and they change how precise we can be, not the risk level.
NEJM also put out a super spreader study on Andes person-to-person transmission today, and I've got a CNN passenger saying she felt blindsided by quarantine orders she didn't see coming. We have the biology, we have the human cost. Let's get into it.
This one's from New England Journal of Medicine.
A virtual consultation was held on May 2nd with medical specialists from South Africa, the United Kingdom, and Holland to discuss the potential link to 2 recent fatalities associated with the same ship. On May 2nd, the United Kingdom officially reported a cluster of cases of severe acute respiratory illness of unknown cause, resulting in 2 deaths and 1 critical illness in a passenger aboard the cruise ship to the World Health Organization through the International Health Regulations of 2005.
The NEJM outbreak letter published yesterday gives us the first peer-reviewed clinical chronology of this cluster, and it's specific. Patient 3 was evacuated from the Hondius on April 27th. Symptoms started April 21st, and by the time he hit Johannesburg, he was on a ventilator with ARDS. That's not a WHO notice. That's a named patient in the top clinical journal in the world.
6 days from first fever to medevac to Ascension Island. Then it keeps worsening, then Johannesburg for a ventilator. And the initial workup was basically clean. Malaria, Legionella, fungal panels, all unremarkable. So he's getting sicker, and nobody on that ship or on Ascension Island knew what they were dealing with.
And that's exactly the clinical trap Andy sets. The first presentation can look like a dozen other things, which is why the NEJM letter matters. It lays out the dead ends in order. So the next clinician who sees a Hondius passenger with SARI doesn't have to start from scratch.
And that brings me to the question I've been sitting on all week. The NEJM superspreader paper came out the same day and documents person-to-person Andes transmission in the 2018-2019 Argentina cluster. Actual named superspreaders, peer-reviewed. Were the people designing the Hondius response working from rodent-only exposure logic, or did they factor in documented human-to-human spread?
Here's the Munichai.
The World Health Organization, WHO, has confirmed that 6 cases of hantavirus infection have been verified in connection with an outbreak on a cruise ship. Out of a total of 8 suspected cases, laboratory analysis has identified the presence of the Andes virus subtype in all confirmed patients. The incident has resulted in 3 fatalities, reflecting a case fatality rate of approximately 38% among those affected.
The WHO number is official now, and it's in peer-reviewed print too. 6 confirmed Andes virus cases, 2 additional suspected, 3 deaths. That's a 38% case fatality rate among confirmed patients. And today's NEJM outbreak letter is the first place you can read the clinical chronology behind those numbers, instead of just the agency notice.
And NEJM also dropped a separate superspreader study today. The 2018-2019 Argentina cluster, person-to-person Andes transmission, documented. So I need somebody to explain whether the Hondius response was built around rodent source-only exposure logic, because that paper existed before this ship ever left port.
Worth being precise, the superspreader paper is prior evidence being surfaced now. It's not new outbreak data, but it does give us a named, peer-reviewed foundation for the person-to-person transmission question, instead of the vague, prior research suggests phrasing I've been using all week.
Meanwhile, Argentine scientists are still physically trapping rodents in Ushuaia as of May 19, which means the reservoir hasn't been found yet. So if any cruise operator is telling future passengers the exposure window there is closed, I'd love to know what they're basing that on.
Here's Brenda Goodman at CNN.
An American passenger who was exposed to the Andes strain of hantavirus on the cruise ship HV Hondius said he feels blindsided and misled by new orders that require staying at the National Quarantine Center in Nebraska under federal supervision.
The quarantine picture we left open last episode has a specific address now. The National Quarantine Unit in Nebraska, under federal orders through the end of May. And per CNN, the policy shifted because additional passengers from other countries tested positive after the original home quarantine guidance went out.
So the official line was, finish at home under local health supervision. And then the rules changed midstream because more people tested positive. That's not just an update, that's a failure. What exactly were these passengers told before they boarded? And when did CDC realize the home quarantine assumption was wrong?
To be precise, the NEJM superspreader paper published yesterday documents person-to-person Andes transmission with identifiable superspreaders in the 2018-2019 Argentina cluster. If federal quarantine architects were working from rodent source-only exposure logic when they wrote the original home quarantine guidance, that paper is a pretty uncomfortable read for them right now.
And Argentine scientists are still physically trapping rodents in Ushuaia as of May 19. The reservoir hasn't been located. So the exposure window at the port is not closed, and cruise operators are still making booking decisions. At what point does "we're monitoring the situation" turn into a legal liability?
New England Journal of Medicine writes,
After a single introduction of ANDV from a rodent reservoir into the human population, transmission was driven by 3 symptomatic persons who attended crowded social events. After 18 cases were confirmed, public health officials enforced isolation of persons with confirmed cases and self-quarantine of possible contacts. These measures most likely curtailed further spread.
the paper that answers the transmission question we've been circling all week just landed in NEJM this morning. It's the 2018-2019 Chubut province cluster. 34 confirmed Andes virus infections, 11 deaths, and the study identifies exactly 3 symptomatic people who drove most of the spread by going to crowded social events. That's the super spreader mechanism, peer-reviewed, named, and now on the record.
Okay, so I've been pushing back all week on pandemic-shaped speculation, but this isn't speculation anymore. NEJM is telling us 3 people went to crowded gatherings and seeded 34 infections. I want to know whether the Hondius response protocol was built for rodent-to-human exposure only, or whether anybody making that plan actually accounted for this documented transmission pattern.
And to be precise about what stopped the Chubut outbreak, isolation of confirmed cases plus self-quarantine of contacts, enforced after case 18. The study says those measures most likely curtailed further spread. That's the intervention model, and it gives us a benchmark for every national protocol we've been watching diverge this week.
Spain went strict, the Netherlands went looser, and now NEJM hands us a documented outbreak where lax, pre-case 18 behavior let a super spreader chain run. That divergence in national protocols looks a lot worse today than it did yesterday.
Isabel Debray, writing in Medical Express.
Tuesday's rat trapping marks the start of fieldwork within Argentina's wider investigation into the origin of the contagion that struck the MV Hondius, killing 3 people, sickening several others, and setting off a global scramble to trace passengers and their close contacts.
May 19th, Argentine scientists were on the ground in Ushuaia. Blue gloves, surgical masks, 150 box traps set the night before, dead rodents into black bags, then off to a makeshift lab for blood draws. That's a datable, named first step in the reservoir investigation, and it's the closest thing we've had to closing the exposure site bracket I've been calling open since May 18th.
150 traps, and they're just starting fieldwork, which means as of May 19th, nobody has confirmed the reservoir, nobody has cleared the port, and any cruise operator telling future passengers Ushuaia is back to normal is running ahead of the actual science.
And to be precise, the investigators trudging through the mud declined to speak to journalists. So we have the action, but we do not yet have preliminary results. The bracket is narrowing, not closed.
Which is exactly the problem for the next ship out of Ushuaia. We're looking is not the same as we found it and we neutralized it. And those passengers deserve to know the difference before they board.
If you follow Hantavirus Watch for clear daily tracking, try Arcadia Mayor Spy Watch, daily court watch on the federal foreign agent prosecution of former Arcadia Mayor Eileen Wong and the related case against Yaoning Mike Sun. Find it wherever you listen to podcasts. You'll find links to every story from today's briefing in the show notes. So if one caught your attention, you can follow it there and read more. That's Hantavirus Watch for today. This is a Lantern podcast.